payment. See, lateral view of skull, they consist of three fossas. It is a temporal fossa. We can distinguish it by lines: temporal line of frontal, temporal line of parietal, then base of mastoid, then zygomatic base, and infratemporal crest. It is the borders of this fossa. After that, you can see the walls: frontal, parietal, temporal, squamous part. It is a wall of fossa. Next fossa, infratemporal fossa. Here is separated by a crest, infratemporal crest of greater vein. Which surface is formed? Infratemporal surface of zygomatic, infratemporal surface of maxilla, and lateral plate of pterygoid process of sphenoid bone. Got it?
Yes.
It connects with pterygopalatine fossa by pterygomaxillary fissure between pterygoid process and maxilla. Now let's talk about main fossa. Very important because trigeminal nerve, not only this passes through this fossa. We should know walls, chair walls of this. Anterior wall is formed by maxilla. You can see maxilla in front.
Yes, sir.
This surface, I said, it is the infratemporal surface of maxilla and tuber of maxilla. This is why anterior wall, it is the tuber and maxilla surface.
Anterior, back of
posterior wall, pterygoid process of sphenoid bone.
sphenoid bone.
Let's see. No, I show anterior, posterior. Let's go upward. Upward, we can find maxillary surface of greater venous sphenoid. See?
Yes, sir.
On this surface, we can find foramen rotundum. Let's go down. There is no inferior wall because this fossa become and finish by a canal, greater palatine canal, and come to oral cavity. That is why no inferior wall. Repeat I. Anterior wall existed, posterior existed, superior existed, inferior not existed. Now let's go medial wall, and I come to the nasal cavity through the sphenopalatine foramen. That is why we can compare which bone form it. It is a perpendicular plate of palatine bone. That is why medial wall, it is a palatine bone, perpendicular plate. Now let's go outside. Lateral wall not existed because we can see the fissure. No lateral wall. That is why 4 walls I already described. Now let's talk about 6 connection of pterygopalatine fossa. 6 direction, 6 connection. Anteriorly in orbit through the inferior orbital fissure, you can be proved. It's really it. Behind I saw before pterygoid canal, and it lead to the foramen lacerum because some nerve passes through the pterygoid canal. Next, anteriorly I said, behind I said, inside let's go. Into the nasal cavity through the sphenopalatine foramen, outside through the pterygomaxillary fissure with infratemporal fossa. I showed you 1, 2, 3, 4 connection. Let's go upward and downward. Upward we can go and come to the foramen rotundum. What? This is foramen rotundum. Lead to the pterygopalatine fossa. Connect with the cranial cavity. Trigeminal nerve branches coming to this. Inferiorly, I already showed greater palatine canal to the oral cavity connection. That is why 6 connection according direction. It's very easy if you try to think.
Yes, sir.
It was a lateral view, 3 fossa, walls, borders, and connections. Let's see the frontal view, facial aspect. 2 orbits, nasal cavity, and hard palate. You should know. Orbit very easy, but this is totally damaged. You can tell. You can bring colorful skull where all bones are present, and you can see which bones are. No, medial wall is formed by lacrimal bone. Afterward, ethmoid, don't visible here because broke, and then sphenoid body behind. Lateral wall is formed by zygomatic bone, orbital surface, greater vein of sphenoid, orbital surface, part of frontal. Inferior by maxilla, orbital surface. And one more scene, orbital process of palatine bone. Superior by orbital surface and orbital part of frontal bone. Okay, now I show some foramens. Not everything because little bit tight. Infraorbital foramen starts in the inferior wall and goes out through the infraorbital foramen. It is a canal. Some vessels, same name, and nerves passes through them. and some other foramens like zygomatic orbital on lateral wall, anterior and posterior ethmoid not visible because broken. Okay? And nasal cavity you should find on a separate skull, half of skull, colorful skull, because here nothing to see, not convenient.
Okay, sir. What about nasal cavity? Sinuses.